Welcome to part 3 of your next series. For this class, we'll be focusing a little bit more on dynamic movement. So if you already have a background of practicing yoga, we will be doing some familiar yoga asanas, but combining them with nerve flossing. So heads up, for today's class, it's less about stretching and strengthening. I'm not asking you to push really hard against something or really elongate until you feel a side stretch on your body, but we're actually focusing on moving, literally flossing the nerve back and forth. So when we talk about nerve flossing, we are thinking of two body parts at the same time. This will get clearer as we go through the class, but just quick example. Your median nerve, as we spoke about, the one that gets most often impinged during for carpal tunnel on your wrist, it passes through here, passes through different parts, but let's just say neck. So if I'm going to stretch at my wrist, I'm going to lax at my neck so that the nerve is pulled in one direction, and then I'm going to do the opposite. So I'm just pulling and pushing the nerve through two different structures just to keep that nerve healthy and mobile. Your nerves should be able to elongate, they should be able to angulate, meaning that they're going to get bent. Sometimes they're going to get stuck in awkward positions. And we want our nerves to have that elasticity. And elasticity, I don't mean like they have to be super long, but they need to have that elasticity, that fluid healthiness that allows them to move freely so that we can have proper connection and healthy connection between our brain and whichever parts that nerve is innervating for the next series part for our hands, and then back from our hands to our nerves. So we're in constant positive, healthy, efficient communication. For today's class, you will need 2 blocks, and we will be using the myofascial release balls, the tune-up balls, so make sure that you have that handy. And we will start in a short meditation. So once you're comfortable, you don't have to sit as I am. You can sit cross-legged, you can sit on a chair, you can lay down, so whatever is comfortable for you. And then when you're ready, just go ahead and close your eyes. And let's just start by taking a few nice breaths. Breathing in through your nose, feeling your belly expand. And exhale to soften. Part of taking an efficient and full breath is to try to keep your belly soft while you're inhaling and exhaling. So if you want to try that, on your next inhale, pause at the top for a second and just kind of press your belly and try to make sure that your belly stays soft. And then bottom of the exhale, same thing. Pause at the bottom of your exhale and just massage your belly a little bit. So soft belly as we inhale, soft belly as we exhale. The theme for this short meditation is long lines. So I'll guide you through a short visualization just so that we have an idea of where our nerves are living for the rest of this class. Take a moment to bring some awareness and attention to your neck. Noticing how the sides of your neck feel. Maybe from your clavicles stretching all the way up towards your earlobes. And bringing some attention to how your head sits on top of your neck. Out of each vertebra comes out a nerve and an artery. When they come out of your vertebra, they come out as single nerves. But as they travel down through our bodies, some of them join, some of them divide, and in certain areas, they form a big bundle of nerves. So, visualizing that as the nerves come out of your neck, they travel down towards your shoulders, passing behind your clavicle. And if you picture, imagine, or feel the space in between the front of your shoulder and the back of your shoulder, somewhere along there behind your chest, you have this bundle of nerves called your brachial plexus on either side. From your brachial plexus, there will be long lines extending down towards your elbows, down towards your wrists, and towards your hands. We have many nerves that come out of our brachial plexus. Some of them pause just by your shoulder. Some of them continue going down towards our elbows. We will be focusing on the main ones that innervate. Innervate just means they kind of give battery and life to our 5 fingers or 10 fingers on both hands. So once again, visualizing these long lines that come out from either side of your neck. They travel down towards your shoulder, behind your clavicle, somewhere behind your chest. They continue traveling down towards your upper arm to your elbow, inside of the elbow, outside of the elbow. They continue traveling down towards your wrists and all the way to your fingertips. Remember that the message needs to get sent back to your brain again. So from your fingertips, breathing up towards your wrists, up towards your elbows, continuing this journey up towards your shoulders, and then continuing towards your neck. And this time meeting at the center of your spinal cord to come all the way to your brain. So as you visualize and you breathe, just really highlighting this area of our bodies. Inhale, full breath to keep your belly soft. Exhale to empty, soft body. I will talk a little bit more about nerve flossing. You're welcome to keep your eyes closed while you listen, or you can open your eyes. So the first nerve floss that we will do, it's easy to understand when we do it, but basically when we floss our nerve, we are thinking of two parts in our bodies where the nerve is passing through. So there's a little bit of a pulling from one direction and bending in one direction, and then you switch that. So let's just go ahead and do the first one, and I'll explain as we do it. You can stay in the seat that you are. I will change my seat. I'm just going to come one level down to sit cross-legged. And we will start with our median nerve. So again, your median nerve passes in front of your wrist. It often is called carpal tunnel impingement here. You've probably heard about that. And as we said in the visualization, it passes out or it comes out from our neck. So with the palm facing down, with the wrist pointing forward, you're going to place your palm down. This is going to stretch the front of your wrist. And because it's stretching at the front of our wrist, we're going to tilt our right ear to our right shoulder to slacken at our neck. So this is pulling towards our wrist. And then to come out of it, we'll take our head in the other direction and we'll fold our palm up. So now it's stretching at your neck and it's folding at your wrist. And we'll do each of these nerve flossing 5 times. So inhale, Press your palm down, let your right ear drop to your right shoulder. Exhale, flip your palm up, let your left ear fall to the other side. 3, inhale. Exhale, no need to overstretch or push. You just let the nerve move. 4 and 5. We'll go to the other side. Go ahead and bring your left palm to face down. Lean your left ear to your left shoulder. This is 1. Go to the other side. As you do this, I just want to say that for today's class, we're not focusing on stretching or strengthening. I'm not really asking you, even when you place your palm on the floor, to really push your hand down or really overstretch your neck. So this is really just getting the nerve to floss forward and back in 2 areas without overstretching or over strengthening anything. Great. Take an inhale at center. And then when you're ready, you'll meet me in a tabletop position. Tabletop to do a few cat-cows. As you're ready, release your belly, roll the shoulders back, lift your chin and your head up. As you exhale, pull your belly in, round your spine. We'll also do a spinal cord floss here. So your cat-cow is about to change and transform. It might feel a little bit odd in the beginning, but you'll get the hang of it. So let's go ahead and meet in a cow position. Right now in your cow, your whole spine is extended. But when we do nerve floss, we want one area extended and one area flexed. So go ahead and leave your pelvis where it is. So you're kind of in a back bend. You're bringing your vertebral bodies, the back side, your vertebral spine closer. So we're going to relax the head down. So you're actually stretching at your neck. And then keep your head here. Exhale, you're going to round your spine. So now you're opening the space in between your vertebral spines, the back of your spine. And because our lower spine and our middle spine is flexed, we're going to extend at our neck. Lift your head up. And we'll just go like this. Relax your belly. You're in your normal cow. But go ahead and relax your head down. And then round your spine. Keep your spine where it is, but lift your head. Let's do a few more. Relax your belly. Go ahead and relax your head. And then pull your belly in, round your spine. Lift your head and your neck. Inhale. Exhale, drop your head. Bottom of the exhale, round your spine. And lift your head up. Great. Coming to a neutral tabletop position, just getting your spine nice and long. You don't have to overextend anything, just feeling the normal curvatures of your spine. Take an inhale, take an exhale. We'll go ahead and keep moving. So reach your right leg straight up and back. As you exhale, step the right foot all the way through. You might want to have blocks underneath your hands. I am going to use blocks for today because, again, it's less about stretching and strengthening. It's more about moving. So I'll place blocks, lowest setting, under my hands. Walk your right foot out so you're somewhat in a lizard position. Maybe lunge a little bit deeper. And go ahead and tuck your toes and lift your left knee up. You're going to keep your left hand underneath your left shoulder. Reach your right arm up like you're doing your normal twist. And here's the change. You're going to flip your right palm up. So once again, you're stretching at your right wrist. You're going to lean your right ear a little bit closer to your right shoulder so you're slacking on the right side of your neck. And then exhale, you'll straighten both legs. You'll flip your palm to face you and you'll curl your fingers towards your right forearm. You'll relax your head down. So now you're bending, you're relaxing at your right wrist, and you're releasing your head. So you're actually stretching at your head and neck. And we'll just move again. Bend your right knee, send your right arm up, flip your right palm. You can even bend your right elbow. And then exhale, flip your palm towards your body, curl your fingers towards your forearm, relax your head. Inhale, 3, Exhale. More about moving with breath, less about stretching. Inhale. Exhale. I believe we're doing one more. Inhale. Exhale. Bend your right knee, tilt your blocks to their second setting, toe heel your right foot back to center, and step your left foot forward. Inhale, take a half lift. Exhale, take a forward fold, and I'm actually going to bring my blocks to their highest setting. Taking 3 half lifts, exhale. Inhale, half lift, flatten your spine, lengthen your heart forward. Exhale, release. 2 more, inhale. Exhale. Inhale. Exhale. We'll just go ahead and swap to the other side. So step your right foot back, lowering your blocks to your comfort level, releasing the right knee down for a moment, lengthening through your hips. And then once you feel comfortable again, lift your right knee up. Right hand stays underneath your right shoulder, reach your left arm up. Flip your left palm up to the ceiling. Tilt your left ear slightly closer to your left shoulder. This is an inhale. Exhale, flip your palm to face you. Curl your fingers towards your left arm. Relax your head. Inhale. You can bend at your left elbow. Exhale. 3 more. Inhale. Exhale. Inhale. Exhale. Let's just do one more. Inhale. Exhale. Bend your left knee. Place your palms down onto the floor. Step your left foot back, plank. Take an inhale in your plank. As you exhale, lower knees, chest, and chin. Slide your knees back, coming to a little cobra. And as you exhale, release all the way down. You'll slide your forearms forward, coming to a sphinx pose. And I'm actually going to face you in a moment. So your normal sphinx pose, elbows underneath your shoulders, spreading your fingers nice and wide. And in our sphinx pose, normally, we're trying to really lengthen our spine and pull our elbows back and stretch the front of your sternum forward and keep your head and your neck lifted. Part of the next series is learning how to release our upper shoulders, which we did in our last class together with some of the myofascial release. So here goes another, let's say, non-traditional sphinx pose that also allows us to soften our shoulders. So you're going to bring your forearms, your elbows a little bit closer. And instead of lifting away from your neck and shoulder, you're actually going to do like what you might think it's a wrong sphinx. You're going to slacken at your shoulders and let the tip of your shoulders travel towards your earlobes. I know it might feel a little bit awkward for a moment. We're not going to be here. But what we're trying to do here is take the work, the load away from our shoulders. You might prefer to keep your head lifted. You might prefer to bring your head down. And then just breathing here for a moment. Taking the effort away from your shoulders. Doing a little bit less with your neck. Inhale, soft belly. Exhale, soft belly. Great. Go ahead and slowly keep your head down. Just bring your hands down by your side. Forehead touches the mat for a moment. Inhale, take a little cobra or higher. As you exhale, you're going to press back to your child's pose. And then go ahead and round yourself forward to tabletop. We're going to pass by a reverse tabletop before we continue to move. So go ahead and turn around. Bend your knees, Your fingers can be pointing towards you or away from you, your choice of preference, and press your feet down. Before you lift too high, look at your hips and make sure that one is not higher than the other. And then only then decide if you want to let the weight of your head fall back. Press all four corners of each foot down and each hand down. Lift your pelvis a little bit higher. Exhale, lower your hips down. Turn around, we'll meet in a downward facing dog. Give yourself a minute here to move in your down dog. Anything that feels good, you can bend your knees. Relax the weight of your head. Let's go ahead and take an exhale. Take an inhale through your nose. And exhale to let it go. Go ahead and lift your right leg up. As you exhale, step it through. Open up to your familiar warrior two. I'm going to face you so that I am looking to the camera. And just meet your traditional warrior two, long arms, soft neck, being able to take a full inhale, full exhale. Reminder, less about stretching or strengthening, just being for a moment. We'll focus on our radial nerve now. Our radial nerve passes along the top of our wrist and innervates the back of our three fingers. So you'll go ahead and make fists with your hands, and for a moment, curl them up. This is going to slacken the top of your wrist. As you exhale, just to add a little bit more movement, straighten out your right leg. This is going to look a little bit funny. You're going to bend at your elbows and you're going to flip your wrist down. And we're just going to do this 5 times. So inhale, rebend the right knee, flip your palms up or fists up. Exhale, bend at the right knee, flip your wrist down. You should be able to feel stretch along the top of your wrist. Inhale, exhale. 2 more. Inhale, exhale. Keep your right knee bent or straight, whatever's more comfortable. You can relax your hands for a moment. Bring your right palm along the right side of your temple. And to strengthen the right side of our neck for a moment, just push your head against your right palm. At the same time, push your right palm against your head. Don't let either win. Great. Take an inhale here. As you exhale, rebend your right knee. Reach your right arm forward. This is going to be odd and funny at the same time. You're going to bring your thumb and your index finger together like you're doing an OK. Stretch them forward. You're going to bring your hand towards you. Flip your palm like you're creating these funny eye mask or goggles with your hands. And you're going to take this into a reverse warrior. This is going to be an inhale. As you exhale, stretch forward. Palm facing down. Inhale. We can just do this. You can do this 3 or 5 times. Lean back and bring yourself forward. 3, flip your palm. Eye mask. Lean back and back. Great. This is to stretch out your ulnar nerve. It's your last 2 fingers. Straighten out both legs. Take an inhale. Bring both arms up. Just taking a nice stretch. Exhale. Release. Your right foot is along the front of your mat. Go ahead and turn to meet both hands on the floor. Step the right foot back. Inhale. As you exhale, once again, lower knees, chest, and chin. Slide your knees and your chest forward. Little cobra or higher. Exhale, downward facing dog. You're welcome to pass through a child's pose. Exhale all the air out. Inhale through your nose, full body breath, soft belly. And exhale. Left leg comes up. Step it through, warrior two. Nice breath, adjust your warrior two, make the stance smaller, bigger. You can also do different things with your legs. We're focusing on our upper body, so whatever you feel comfortable. Make fists with your hands. You're going to flip them up. Inhale. Exhale, straighten the left leg, bend your elbows, flip your palms down or your fists down. Inhale. Exhale. It's also a little bit coordination of movement. Inhale. Good practice for our brain. Exhale. Long lines of energy, healthy long lines. Exhale, that can elongate. Inhale, exhale. Relax your hands. Take a moment here. I just want to mention that if you are going through anything that is aggravating your symptoms, like it's some chances are that you might be doing this and you might feel the tingling. So you might need to do less reps. You might need to take this one out today and do it when your neck is feeling a little bit softer. So if you're doing it and it's really making your hands tingly, do less or skip it for the day and do it when the symptoms are a little bit less intense. Ulnar nerve, reach your arms forward. You can rebend your left knee. You can only just use your left hand. Thumb and index come together. Flip your palms, create a little one lens mask for you, and then take this back into a reverse warrior. And straighten the left arm, flip it down, straighten the left leg. If you want, I'm just adding random movement. Flip your left palm, left fingers towards the bottom of your face so you can flip and be here. Take it back, reverse warrior. I just choose to do 3 here because it's pretty intense for me to stretch behind my wrist. So if you're feeling the same, I think 3 is enough. You can hold it just a second longer. If you want to do more, do 2 more. Inhale, sit down on your warrior 2 and just easy flow. Modified or traditional flow, up to your practice. Again, today is less about flowing, more about getting those nerves to move. Exhale all the air out. Take an inhale through the nose. Exhale to let it go. Lower your knees down. Take a moment to move in your tabletop if you need. Okay. Our next asana for spinal cord care and for our neck will be a supported fish pose. So go ahead and grab your 2 blocks. I'm going to switch to my cork blocks. And you'll place the one supporting your spine in its second setting, and then the one supporting your head in its highest setting. So you're creating a T, but you want the block that's supporting your head higher than the one that's supporting your neck. You can turn around, start laying down. I want you to have the block not all the way down towards your lower middle back and lower spine, but way higher, so that it's actually supporting the space in between your scapula, and we're getting this nice opening of your chest. You might have to adjust the one that's supporting your head, and you can bring your arms out to the side. Often students will ask me, if it's okay to not use the one for your head and then have your head completely falling back. If you feel like you're getting some benefit of really opening your throat area and opening your chest, go ahead and do so. Remember that the practice, you are your own best teacher and you know what your body needs. But if you feel like when you do it without a block supporting your head, you're kind of throwing your head back and it's feeling like it's overextending your neck and spine, which I do have to admit is what happens often. I think my personal opinion is that it's not necessary. But again, you are your own best judge. Having your arms wide so that you can feel like you're actually stretching out the sides of your chest. And you can keep your knees bent or you can straighten them out. We'll be here for, let's say, 2 more minutes. Creating a little bit of extension along our upper thoracic all the way to our neck. Remember that it's never completely black and white, but anything with disc bulges and disc herniations prefer extension, which is back bending, because that way you're pushing the disc forward rather than continuing to add pressure to push it out towards your nerves. For the last minute, I do want to open an invitation for those of you who like to do fish pose with no support, since we've already done a bit of the prep. But remember that that overextension of your neck might still happen. So you want to think about lengthening back rather than just falling back. So if you want to meet me there, start to gather your arms, bring them closer to you so you can have some support to press yourself up. Bring the blocks out to the side. If you're not doing this variation, you can just stay where you are for the next and last minute. For fish pose, you can have your arms facing down by your side or underneath your pelvis, kind of tucking them underneath your glutes. Bring your elbows a little bit closer. And one way to really encourage that lengthening of the spine is just staying here for a moment with your chin tucked in and really opening the sides of your chest. And then maybe instead of just letting your head fall back, you're still lengthening your head and feeling like you're like pointing your nose towards the ceiling and not with control letting your head fall back. Keep pressing your palms, your forearms onto the floor to lift your chest up. Exhale, pull your belly in, engage the front of your neck to slowly bring your head back in. A lot of work, your head is heavy. My head is heavy. And then separate your hands and lay all the way down. Feel your feels. Feel the long lines that are coming out from your neck, traveling all the way down to your fingers. And we'll wrap up this class with a suboccipital release. Your suboccipital muscles are the muscles that live right underneath your skull. So go ahead and grab your tuna balls. You need a block to support your head. So go ahead and bring your block to its lowest setting for a moment. Find the right spot. And then you're sandwiching the balls in between your skull, just where your skull starts or ends, and in between the block and your head. So the balls stay in their little tote bag, they stay together. And you want to make sure that you feel supported. So beyond simply releasing these tiny muscles that play a part in moving our head and our skull, as we rest here, we want to let the weight of our shoulders and spine fall so that we're also creating traction in between all the vertebrae in our cervical spine in our neck. So staying here for about 2 minutes, maybe making your exhales a little bit longer. And if you want to check back in with that soft belly, once again, just taking a nice inhale. Top of your inhale, just feel your belly a little bit, keep it soft. And same thing with exhale, empty and keep it soft. If you want to stay here a little bit longer, feel free. I will finish and pause the video in a moment. I hope these 3 cervical spine classes were educational. I hope they were informative. Please reach out if you have any questions, if something was not clear, or with any feedback. I would love to hear back from you, and have a great rest of your day.